Good evening to all the viewers. A very warm welcome to this session of Nutrition Nectar. Thank you for joining us on today's program, which is on COVID and coping behaviors. Today's guest on my show is Dr. Shilpa Sreenath. And as always, if you have questions, please type them in the chat box. Welcome to you as well, Dr. Shilpa Sreenath. It's great to have you with us.
Good evening, and good evening to you, Sheela, and to our listeners, viewers. I'm very happy to be here today with you and to have this conversation. It is the need of the hour, I understand, and I'm glad to have the opportunity to share some of my experiences as a psychologist with the audience.
Wonderful. We already have Susan Verghese, who's typed in the chat. Good evening. Looking forward to some tips on coping with this challenging pandemic. So there you go, Shilpa. That's for you.
All right.
All right. Let me begin, as always, with showing the disclaimer. Please give me a minute. I need to slide share.
Mm-hmm.
Is that visible?
Yes, it is.
Wonderful. The views expressed in this program are for information only, with no intent to harm or offend any individual, group, company, institution, or organization. Kindly seek a physician's help if you have a medical problem, and please consult a qualified dietitian for personalized diet services. I'm going to stop sharing my screen. All right, so let me introduce Dr. Shilpa Sreenath to all of you. Dr. Shilpa Sreenath is a counseling psychologist with a D.Psych doctorate from Glasgow Caledonian University, which is accredited by the British Psychological Society, UK. She is registered with the Health and Care Professionals Council, UK. She has 12 years of experience working in the field of mental health and well-being, and worked in Scotland for 11 years before moving back to her hometown, that is Bangalore. She is the founder of Flow Psychology, a private consultation space which delivers in-person and online psychological support to individuals in a modern, non-clinical environment. Shilpa offers her services for individuals and organizations not only in India, but also in Australia, Egypt, UK, USA, and the UAE. Over the last 5 years, Dr. Shilpa Sreenath has advocated for and delivered ethical, evidence-based psychological care to adults and adolescents by engaging with educational institutions, corporate employment assistance programs, psychiatric services, and fitness-focused companies. Her website is https://flowpsychology.co/ is accessed by people worldwide. Dr. Sreenath's professional values are underpinned by 3 decades of cross-cultural life experiences. This has shaped her understanding of and learning from diverse cultural, historical, socio-economic, and religious contexts, mental health, and holistic living. That's a wonderful, what should I say, a resume, Shilpa. And for those of you who didn't get the website, I'm going to repeat it. Dr. Shilpa Sreenath's website is https://flowpsychology.co/. So I hope some of you will be able to go to her site and look up all the great work that she's doing. And I think they can even make appointments with you there. Am I right?
Yes. There is an option for a new client and an option for a returning client. And the sequence of information I need coming my way would be different in both cases, but the website will take you through that journey. And
okay.
Yes, my phone number and email is also very visible. So if you just want to jump the steps and just contact me that way, the audience is most welcome to do so.
Okay, that's wonderful. Thank you so much for being so open about it. Let's begin with the discussion, Shilpa. My first question to you is, has the number of people turning to psychological experts increased during the pandemic? And if yes, is it because the public is willing to shed inhibitions and share feelings or emotions with experts, or is it something else?
While you were stating your disclaimer, I thought one of my own, which has occurred to me on the spot. So I'm going to share that with the audience.
Sure.
I am a counseling psychologist. I have a specific type of training, a certain way of working, and therefore any observations I have made with my clients, I'm not speaking for all professionals in my industry and in the field of mental health. I'm providing information based on my training and my understanding of what has been going on in my surroundings with my clients and in my environment. So having said that and putting that out there, yes, there has been a surge of individuals. I work with adults and adolescents. There has been a surge of clients coming in to seek psychological support. Within the Indian context, there are two types of individuals who have sought out therapy or psychological support at this time. Those that were struggling with their life issues even pre-pandemic, but may have created a framework of coping mechanisms. Their life was helping them manage their struggles and therefore did not need or feel the need to seek out support. So there's those individuals and those others who were directly hit by either the illness itself or saw the virus affecting their loved ones. And they have encountered vulnerability in a new way, like never before. So people are definitely seeking out mental health support and dropping their inhibitions, being more open-minded, I'd say, being more open-minded to ask questions and care for themselves.
I think that's a good thing to do. So you've been counseling a number of persons online, I think, especially during the pandemic. What is the general attitude or emotions that that people exhibit when they consult you?
With or without COVID, if you're ringing a psychologist, that means you're not in the best state of mind. You're emotionally distraught, perhaps lacking clarity, feeling a bit confused or stuck in your life with maybe one aspect or many aspects. So individuals who have sought out therapy are in that state of confusion. One thing that is unique to this last year is that besides symptom-related distress, which is often the case, I'm suffering from anxiety, I find my anger, I don't manage anger very well, I think I'm depressed. Besides these issues that one may seek out support for, I have also noticed individuals coming forward because of more existential questions, pursuing bigger, more expansive answers like, am I happy? Why am I here? Why am I doing the work that I'm doing? Am I happy in my relationship? Something feels like it's missing and I never knew it was until there's this void or this change of global circumstance. So these are some of the attitudes and questions that people are seeking answers for through therapy.
That's interesting. So would you kind of categorize these as mental health problems? Or if you don't, then what kind of mental health problems do you come across? And also, do they vary according to age?
I was thinking about how I want to answer this question when I was revising, and I made this little slide.
Okay. All right. So let me read
slides,
it out.
But it's different. It's a paper slide.
Okay, that's okay, but it's very clear. So authenticity, autonomy, grounding, anchoring, connection, inspiration. What are all these words saying?
Yes. Mental health issues are categories in the form of anxiety, disordered sleep, depression, panic. They're kind of diagnostical categories. But one may ask, what is the person lacking or feeling the need for or missing, as a result of which a mental health issue is manifesting itself? So the symptoms in themselves are secondary, and the themes, the existential issues that people are grappling with are primary. And in that sense, during the last year, I have observed in working with my clients, people are feeling the lack of autonomy. They're experiencing the lack of autonomy. They're experiencing the lack of connection. People have experienced the need for being more authentic, living their life according to their terms, or wanting to connect with the self. So connection is another one of them that people have felt has been lacking. And lastly, inspiration, that sense of spark about life, whether it's in the form of fun or in the form of knowledge. So these 5 themes: authenticity, autonomy, connection, grounding in the sense feeling anchored, like they're not just floating without understanding what tomorrow brings. And lastly, inspiration. These are some of the themes that people are grappling with as a result of missing some of these things, wanting some of these things, valuing it differently. That's when you have these issues that crop up.
Okay, so let me read these out now. Can you take it? Yeah, that's perfect. Acute anxiety, panic, health anxiety, grief, bereavement, loving the change, languishing, disordered sleep, hating the change, binge of various things, and sadness. Okay, I'm a little confused because you're also saying, on the one hand, loving the change, and on the other hand, hating the change. So are you saying there are two different kinds of emotions?
Yes. I wrote down all the different types of emotions that I encountered. And while we are holding the context that COVID has been distressing, while that is our premise of today's dialogue, I also experienced, it's not all doom and gloom. I have noticed beautiful things come out for people, like a greater valuing of their relationships, a greater understanding of community and their civic sense of how they want to participate in the world outside of their own little, life. People's exercise routine, sleep routine may have been streamlined in this period. So lots of good things have happened also. And therefore, I thought it was important to write that one. I have encountered people who say, I'm loving this period. It has brought me so much good. And others who have said, this change, I'm not coping with it very well.
Oh, that's interesting. And it's nice to hear that there has been a lot of good that has happened, in the mental health space too. Especially when you say about increase in exercise and better sleep and things like that, that would definitely make some of us happy. Moving on to the next question. What exactly is COVID behavior? That's the title of today's program. So what exactly is it? Is it a particular way that a COVID patient, active or recovered, behaves, or is it the behavior of a person who is tending to a COVID patient, or is it something completely different?
As many individuals as there are who come to see me, that many diverse patterns of behavior. Because how an individual responds to a crisis, whether it be losing their job or it be a promotion, which looks like a good thing to have happened, but then you're grappling with that change, or a pandemic. How a person responds to a crisis depends very largely on how they're wired in the first place. There is no such thing necessarily as COVID behavior. It is more the case that who are you as an individual? What is your temperament, your general personality? What mechanisms, both healthy and unhealthy perhaps, were already put in place? How balanced is your life? How secure are your support systems? And thereon, when you encounter something of a pandemic, or you yourself have faced this health issue, or you're witnessing, experiencing loved ones facing it, then how do you respond to that? And in a way, I'm sorry that I don't have a specific answer to tell you that there has been uniformity, but because there has not been. Whether an individual responds to a crisis or a health issue with resilience, a sense of realism, using knowledge to their benefit, really depends on how they relate to a health issue. I have noticed two types of people: those who perhaps have known poor health in their life, and in that sense may not necessarily have, they may have felt worry and fear, but were not hit by a sense of urgency, desperation, or real panic during this period. And then there are others who one may define as normal, who have lived quite robust, resilient lives and have experienced COVID, both the illness, whether they faced it themselves or their loved ones, or looking around and hearing the news, and have really encountered that with great fear and a sense of uncertainty, not knowing what is happening and not being able to find that sense of grounding in the experience. So who you are before the pandemic happened really supports, or otherwise, how you managed or how you are managing this period.
Okay, that's interesting. So what you're saying is there might be some kind of a common behavioral patterns amongst groups of people, or every individual reacts differently based on how he or she has lived life earlier, right? Okay, so for example, COVID patients versus COVID caregivers versus relatives of COVID patients who do not live in the same city. So is there some kind of a common behavioral pattern you see amongst these groups? Or even amongst these groups, is it very different?
Let's keep in mind that the pandemic began in March of last year and carries on in many parts of the world, including ours. When we are trying to understand patterns, we have to keep in mind that this is almost like a longitudinal study. It isn't a week or 2 weeks or 3 weeks we're talking about. We're now talking about a year and 3 months. It might be more useful to provide a comprehensive answer a year or two after the pandemic ends, to be able to use different points on the timeline to see what kind of commonalities emerged. Ultimately, when we talk about are there any particular patterns that are similar, what are similar are these themes that I pointed out. Whether you have suffered the illness, the disease, or you have witnessed someone else or a neighbor, or you're hearing it in the news, ultimately how people have been affected by it is more thematic, in the sense they have been affected by it because sometimes you may feel, I'm not able to live the way I want. I feel healthy, but I don't have the autonomy to live the way I want. Some others might have felt that I am isolated, I'm lacking connection from my support systems. I'm too far away, I live in a city, whereas my family lives in a city in a different state or even country. Some others may have felt that closer to their environment, everything is pretty hunky-dory, nobody is ill, their jobs are secure, And yet they may feel a sense of meaninglessness, joylessness about their day-to-day life. So these are some of the patterns or attitudes that those who have gone through the disease may have encountered, those who are looking after others in their families or in their friendship circles may have encountered on their behalf. The lack of autonomy and to be able to live the way you want and feeling isolated from those important connections and not feeling anchored in your day-to-day life. These would be some of the patterns that are coming out. And a result of that could be many things, many different forms of symptoms.
Mm-hmm. Okay. That's, yes, it is, I guess, difficult to kind of categorize right away. Perhaps later you might come up with some kind of a study.
Mm-hmm. Yes.
Right? Based
yes.
on what you have seen. Okay, that'll be wonderful. Moving on to the next question. Any physiological changes that you have come across related to COVID?
Related to COVID, perhaps as a result of the pandemic.
Yeah, all right. As a result of the pandemic, have you come across it amongst your patients? Mm-hmm. Any physiological changes?
Mm-hmm. At different points in time, clients have described a new sensitivity to stimuli. So if you have been indoors for long periods of time, and during those pockets of the lockdown lifting in different parts of the world, when you step out and suddenly you encounter traffic, you may find that you're quite sensitive to those sounds in a way that you weren't before. Or you may be quite eager to visit a restaurant or an open air, the terrace of a cafe that you used to frequent, and then suddenly witnessing that many people, which would still be fewer than what you're used to, may make you feel uncomfortable. So there is this heightened sensitivity to the environment, whether that is smells, sounds, sights. My clients haven't encountered it as deeply distressing, but have definitely observed it to be change, as though their brain had unlearned and now is trying to relearn what was once normal. Both have happened: poor sleep and a better sleep routine. And that has impacted people, as you may imagine. Lesser sleep, binge watching Netflix, or staying awake for long hours, perhaps on a Zoom call with friends and family in other time zones, may have affected people's sleep. Whereas those who found that they had all their other distractions had been taken away, found that they are getting to bed at a regular time every day, and as a result feel quite fresh in the morning. So physiological changes have been for the better and for the worse, depending on how you are grappling with the change.
Okay, that's an interesting answer. Now coming to the coping mechanisms, can you list some of the coping mechanisms for COVID affected people? If you want to share some examples, please feel free to do that. It'll be interesting if you can share a couple of examples.
Once again, when we are talking about coping mechanisms, I want to ensure that the response doesn't seem too generic, and also kind of lean away from it being gimmicky in 4 classic behaviors or coping mechanisms. I find it difficult to do that because I think it is very individualized and unique to that person's needs. However, to answer that question, I have been helping my clients follow with the Perma model of well-being. It is a very popular theory of well-being in positive psychology.
Okay, so can I just read those out?
Yes.
So it says positive emotions, engagement, relationships, meaning, and accomplishment.
Yes.
You need to explain these points, please.
Yes. So when we talk about coping mechanisms, we understand that, just speaking broadly, we understand that eating well, sleeping well, being connected with loved ones, friends, family, consuming humor, joy, exercising are all good for us. Broadly speaking, one may say these are useful coping mechanisms. Individuals find themselves more motivated and empowered to take on specific goals or activities in the form of coping mechanisms when they understand why that specific exercise or practice is unique and useful to them.
Mm-hmm.
The Perma Model for Well-being states that if you are able to cover these 5 aspects in your weekly life, in your monthly life, one may say you are living optimally. One may say that you are catering for your well-being. This model is not specific to the pandemic. It is a model of described in positive psychology and these 5 factors or parameters or indicators that will help you live well. Positive emotion, engagement, which means to participate, to be part of.
Okay. Intellectually, physically, in all ways, is it?
In all, whichever one makes you feel well. Some are inclined to engage with a poetry group, a creative writing class. Some are inclined to engage with a cooking class. Some find engagement using their hands with soil in gardening. Relationships, and by relationships, let's state the obvious, we mean positive, healthy, nourishing relationships. So we have positive emotion, engagement, relationships. We have meaning as M and accomplishment as A. Meaning can be derived in various ways, through prayer, spiritual pursuits, playing with your nieces or nephews or children at home, learning about a new discipline or subject that you've always put at the back burner. And accomplishment can be anything. It could be work related. It could be a good team meeting. It could be having a dialogue with another professional about COVID and coping behaviors. So coping mechanisms can be any hobbies, physical activity, bonding with loved ones, doing well at work, optimizing your sleep. It can be physiological, it can be behavioral, it can be interpersonal, it can be spiritual. There are tons and tons of coping mechanisms. And if we are able to use the Perma model to understand which ones we are picking and what it's doing for us, then it's likely that we will experience well-being.
So, let me understand this better. Are you saying that every individual have to choose all 5 of the PERMA, right? All of the 5 in order to live better, live well, whatever, or even choosing 3 or 4 of the 5 will help? How does it work?
We have 7 days in a week. Sometimes it's not possible to even manage one, let's say. The model acts as an indicator to help you assess what aspects of well-being might be missing and what aspects you are catering for in excess to substitute the other. In other words, during COVID, I might exercise rigorously every day in a way that I hadn't done pre-COVID because I have the time and I don't need to travel for work and I have that extra hour. This is doing good for my physical health, definitely doing something for my immunity and maintaining weight or sleep and other aspects. In the meanwhile, it might be that I am arguing relentlessly with a spouse or a partner in the same household because we are getting sick of seeing each other day in and day out, and both being affected by the current circumstances. Doing a lot of one does not substitute for the other, but it definitely does its part in looking after how you are coping during the pandemic. So moderation is key. And let's say you are in your final year of university and you have to channel all your energy into accomplishment. Fair enough, perhaps relationships will take a backseat. Engagement in the form of hobbies will take a backseat. That is understandable. Our well-being doesn't mean happiness. It means wellness. And therefore, coping mechanisms can be as many as a person wants to inculcate, bring into their life, as long as they know why they are doing it. You might go to an online Zumba class because you want to look after your physical body. I might use the Zumba class for relationships because it's the only place where I'm meeting 12 other people during the pandemic, and I'm having a lot of fun in that online class.
Yeah.
So the coping mechanism remains the same, but how it is helping you and how it is helping me is different.
Yeah.
What we are getting from it is different.
That's a great observation. All right. So we all know that social media has played a very big role, both positive and negative during the pandemic. What are your thoughts on social media and behavior?
This is a very interesting question. And I lean towards I have to be honest, I lean towards being a bit skeptical of social media and how it influences a certain set of clients, especially younger adults, adolescents. I say that but I know that during this time of our lives, when other forms of support, other forms of engagement with the real world have been taken away, so social media is definitely providing some perceived sense of autonomy, some perceived sense of connection, some sense of grounding with a community of people who might all be interested in a specific fashion trend, a specific music genre, a specific type of comedy. And therefore, it's bittersweet, my relationship both as a human, as a person and a professional with social media. I think, as I said previously, everything in moderation is useful. And if we are misusing a particular strategy or overusing a particular strategy, whether that is eating, exercising, or digital consumption, then it will do us harm.
Yeah, absolutely. I agree with you there completely. All right. Coming to the last question, how long does it take for a person to get back to normalcy after counseling? That is, assuming that a person becomes normal after counseling. Do we have to wait for the pandemic to go away, or do you think the COVID-related stresses will go away with the pandemic, or do you think it'll, for some reason, persist for a longer time?
I think I'm going to answer those questions perhaps backward front, in the sense, we are not robotic. We human beings, we don't switch on the brain and switch off the brain. All that, and it has been a year and so number of months, all that we have each gradually learned to unlearn and get used to, it will once again take time to perhaps move back into what was once considered normal. And therefore, some of us might function with that change process quicker than others.
Mhm.
When it is related to the pandemic, COVID itself, and let's say you have encountered health anxiety or a sudden fear of germs and viruses that may have been acutely pronounced in this period, and you've never encountered these kind of symptoms previously in your life, yes, one may say we need this pandemic. It is contextual fear, and we need this time of our lives to pass, and your symptoms will drop off quite naturally, quite organically. You asked me how soon people will feel normal again after counseling.
Yeah, if that's possible.
Yeah. As a practitioner, I perhaps don't use the word. I understand normalcy differently than how it might be used. This word would be used generically. But let's say what normalcy means in this case is that the person is starting to feel like what they want to feel.
Mm-hmm.
They're feeling themselves again, like themselves again, right?
Yeah.
The hope is, and the goal is that the client doesn't have to wait for therapy or counseling to end before they start feeling normal. The idea is that they're beginning to feel normal or beginning to feel that their needs are being met. They're feeling like themselves again during the therapeutic process, not after. After is just a period of maintenance where you might see your psychologist, your counselor, your therapist once a month to ensure that you're keeping up with the work that you have done during that therapeutic process. So normalcy is meant to return during the intervention.
Okay, that's good to know.
Mm-hmm.
So one can actually start feeling normal during the very first visit with the therapist, right?
Mm-hmm. Mm-hmm. Yes, there is great relief, at least. Some may call it the halo effect, which is what, the therapy honeymoon period. But if you are sitting on lots and lots of stress, distress, pain, hurt, grief, confusion, and suddenly you ring this person and you have 60 minutes and they're helping you try to untangle all of the stuff that's going on for you, there is great relief in that. That itself the client might experience that as, oh, I feel so much better. I know my problems haven't gone away, but I feel like this fog has lifted. And, so receiving that support can make you feel normal again. But then gradually, depending on how complex the concern is or what the goals of the individual are, the counseling process or therapy process will take that many sessions.
Of course, yeah. Okay, well said. So would you like to say anything else before we go to the couple of questions that have come up in the chat from the viewers?
Yes, actually, I would do. And we as psychologists are meant to support people during hard times, of course. There sometimes may be this bias that if you have a problem, the solution ought to be there in front of you. But during things such as, unforeseen circumstances such as a pandemic or the sudden death of a person, even pre-pandemic or otherwise, often you are left with grief. And there is nothing wrong with that. If you are encountering distress, pain, unusual amounts of stress during this period, I would like to convey that it is normal, expected to encounter those feelings at the moment. You are not suddenly pathological or morbid in any way. And you don't have to fall under a diagnosis of sorts, some strong, strict, grim category of mental illness to seek out therapeutic support. You can be a hale, healthy, mostly happy person who is going through this season, this period of their life where they're feeling unsettled, they're feeling in pain or isolated. And a therapist can definitely help. Any healing modality can help you in this period. But largely, some of the emotions that we are all encountering is expected. It's not dysfunctional. So I just want to remove that bias that, if you are feeling unwell, that means something is wrong with you. No, you are just a human being and you are experiencing what you're experiencing because of what the world is experiencing. So self-compassion will go a long way during this time.
Okay, very well said. Thank you, Shilpa. And I hope that makes the viewers feel a lot better. Let's look at the chat now. Susan Verghese, yes, I already read out her message in the beginning. Thank you for joining. Lovely Puri says, me too, which means she was also looking forward to some tips. And I hope you got some tips from this program. Thank you for joining Suparna Ashwin, Neena Joshi, Swarupa Kakani. Neena Joshi has a question. Has the online mode of counseling helped people to seek more than the in-person mode?
Broadly, yes. Broadly speaking, yes.
Okay.
Many people who would otherwise who may have certain stereotypical ideas about a psychologist, a clinical setting, who may not otherwise reach out for support, have found it a bit more comfortable to be within their own premises whilst speaking to a therapist on a screen. That has really worked to ease in the discomfort one might feel in working with, in meeting a mental health professional for the first time. No doubt about it.
Okay, that's interesting. Beena Nayak, thank you for joining. She has a question. How different is the behavior in children as compared to adults during the pandemic?
Anything I might say now will be not a result of my professional experience, because I'm not a child psychologist, so I don't want to speak, out with my place. I work with adolescents and adults, not with children. But if I were to think of teenagers as grown-up children, which is often what they are, I would say that young people need framework and they need diversity. They thrive in having diverse stimuli, and I believe that. For at least for college goers and high school students who they have really felt the loss of socialization, which is saddening because it is that part of your development, your lifespan development, where you learn a lot through socialization. And I believe that it has affected young adults by making them feel isolated, sad, and lacking inspiration, whether it is the studying, completing projects, playing, going to the cinema, meeting friends. So I think I don't know what I could say about children per se, but I can say that teenagers, adolescents, and young adults have experienced isolation in a more pronounced way.
Okay. Yeah, I think that was a good answer. Thank you. Isak, I think that's how the name is pronounced, says, thank you for joining, and says, strongly recommend to get counsel for any psychological issues with Dr. Shilpa Sreenath, a great therapist. Oh, wow. Thank you so much for that message and compliment to Dr. Shilpa Sreenath. Shilpa, that was for you.
Thank you.
Sheila Dange has a question. I don't think anyone likes pandemic times. The positive takeaway is people could spend quality family time, follow good health routine. The sad part is economically businesses hit. Yeah, that's so true. Do you have anything to say about this? I guess the people who are in business and who have had to close their businesses or reduce, their income because their businesses hit, I guess those are the ones who have more issues than those whose businesses have not been hit by the pandemic. What are your thoughts on this?
Any information I share with you this evening, I'm ensuring that I'm bringing my day-to-day work experience as the resource here. So certain factors play a role in the sense I'm a private practitioner. And as we know in India, unless you have medical insurance that's covering therapy, whether you go to a public hospital or come and see a private clinic, you are paying for therapy. Therefore, if there might be anybody who's suffering loss of work or has become unemployed or redundant in this period, the sadness is I haven't seen them because they obviously have not come to therapy during a period where they are not able to financially.
Yeah.
So I'm putting that out there. Yes, this has happened, and many of my clients are talking about the difficulties that they are encountering at work because they're not sure whether their position is secure or the team will be around. These are some of the issues that have been discussed in therapy sessions. There's no doubt about that. But when I say that the pandemic times have been, I'm not saying that they have not been troublesome, worrisome, and scary, but I know that those who have had an openness to make the best of the given circumstances have encountered stability. They have made it happen for themselves. And in some circumstances, that has not been possible. I appreciate that. Yes.
Yeah. All right. Moving to Loveleen Puri's question, will only counseling therapy work, or do you even prescribe medications, especially for someone in their 80s?
Okay. I suppose that there is need for clarification with my profession and what I do. So I believe this question is for a psychiatrist. I am a counseling psychologist. We are both professionals in the mental health industry. A psychiatrist is a medical practitioner. They have a degree in medicine. And as a result, they understand psychopharmacology and are the right professionals to prescribe medication. I would not speak for a colleague because this is not my area of expertise. Talk therapy and medication work hand in hand. Not one is better than the other, but a psychiatrist and a psychologist, both as team members, will tell you that oftentimes medication may not be necessary and therapy or talk therapy might be good enough to help release a person's distress. On the other hand, a psychologist may often say, this person of a certain age with a particular type of problem, whether it is neurochemical, age-related, might benefit with medication first, at least. And medication will level them in a way that therapy can then do its bit to support them further.
Okay, so in such a case, if you were to come across such a case where the medication would probably help initially and then provide a kind of a support for the therapy that you offer, you would refer this person because you're a psychologist, as you said.
Yes.
And so you would refer this person to a psychiatrist.
Correct.
For the prescription. Is that what you're saying?
Yes. If this person has come to me first, I will, during the first hour or the first 2 hours of getting to know this individual, assess that they are in need of medication, that their symptoms are, or their age, or the complexity of their health issue requires chemical intervention. I may move forward in providing support hand in hand with my colleague, who I will then refer this client to. I will speak with the colleague, send out a letter, inform them of why I think medication is useful. Oftentimes we see eye to eye. And once this medication is put in place, I may not necessarily wait for that prescription to end. I may work with that individual side by side.
Okay. Well, that's good to know. All right. Susan Verghese has a question. How do we support someone who has anxiety but doesn't want to consult a professional?
Oh, this is a difficult one. There are on the internet, and I suppose I have to think on the spot now to provide resources. They may or may not come to me, but there are resources on the internet in the form of mindfulness and meditation apps that might really help. Self-hypnosis videos on YouTube, theta wave music for sleep. There are lots of self-help guided meditation resources on the internet. Also, if the person has a phone, then I would recommend Calm, which is an app, and Headspace, also another app, that will provide mindfulness practices, meditation scripts to individuals who might be encountering anxiety. And as a result, encountering other problems like panic attacks, poor sleep, tearfulness, apathy, or a sense of void, emptiness. These are all, let's say, little cousins of anxiety. They're always creeping around. They're a cluster of similar problems. So if someone doesn't want to seek out a professional, it is very tricky to see your loved one suffering and not wanting to reach out for help. But these apps could really help in emotional regulation, which is to de-escalate that heavy cortisol overload that is happening for that person during an anxiety episode. I would suggest these apps.
Do you mind repeating those two names, please? Calm and?
Calm, as the word, and Headspace.
Headspace. Okay.
Yeah.
So I hope that'll help the viewers in case you want to help yourselves without going to a professional. And I don't see any other questions here. So what I'm going to quickly do is I've kept Shilpa's website ready here. So I'm just going to put it in the chat box. So there it goes. I've just put, Shilpa, I've just put your website in the chat box. So if people want to make a note of this, you can go to Shilpa's website, and as she said earlier, her phone number is there, her email address is there. You can get in touch with her directly, or maybe just look around the website and see what are the what are the offerings she has as a psychologist and as a therapist. So I guess that's it for now. So let me thank Dr. Shilpa Sreenath for spending almost an hour here with us, sharing your knowledge, your expertise, your experience of so many years. Thank you so much for your time and for all of this. And thank you very much to the viewers for being, so interactive, and for participating, and for your presence. If there's anything else, please let us know now. If not, we will say bye-bye to all of you. Take care, stay safe, and see you on the next Nutrition Nectar program.
Thank you, Sheela.
Again, Shilpa.
Thank you.
It was lovely to have you here. Bye-bye.
Bye.